I'm Giovanni Lamura, and I'm leading the Center for Socio-Economic Research on Aging within the National Institute of Health and Science on Aging here in Italy. And the experience of aging in Italy is among the most, I would say, remarkable across the globe. As many already know, we experience right now one of the most aged populations in terms of share of over 65-year-old people, and very low fertility rate. And in this regard, the MENA region is becoming closer to this model, and therefore I think that many of the lessons which we have been learning in the last decades in this country might be helpful as an example for policymakers and practitioners in the MENA region too. Well, one aspect is certainly how to prevent isolation of older people. Right now, Italy was in the past a traditionally very family-based country, but through the decreased fertility rate, of course, number of children has reduced, and so younger cohorts are less and less available. And you can really see that older people, also due to the changing living arrangements, are becoming more and more socially isolated in this country. So I think some of the best practices you can find in this country in terms of how to address social isolation of older people might be interesting to be known also for the MENA region policymakers. The strongest example of social capital available to older people in Italy I think can be seen in the experience of volunteering networks across older cohorts. We have the three main, I would say, trade union-based volunteering organizations which reach over half of all older people, so as enrolled members. So that means actually they are available across the whole country, and they provide services, they provide meals on wheels, they provide shopping services, company, and sometimes they bring all the people also to doctors or healthcare centers. So it's really something you can see the community is lived in terms of social capital made accessible to all the older generations. Well, I think on the one hand, and this is already made available, the government, which in Italy is primarily the regional government, but also at national level, in other countries could be the relevant one, can make resources available to support older people in terms of cash for care on the one hand, schemes which can be used also to buy on the market some services, but also to improve the delivery of care through daycare centers. They are increasingly important, especially in the field of dementia we see in this country. At the same time, I think that even the volunteer networks might benefit from some support and recognition by the state, as this would make them even more effective in reaching out to all most vulnerable older people. Well, you might have direct forms of support by granting some sort of funding to them, but there might be also some indirect forms, and this has been available since a few years. For instance, through which is called a welfare scheme for corporates, for companies in a sense, by offering them a sort of a bonus which can be used by employees to buy services available for their older parents or care recipients. So this is a sort of beneficial opportunity since it is fiscally more advantageous, and which in the end increases the market of services offered to older people. If I think of the younger older people, I would suggest to keep on considering the benefits of an active aging in all different domains of life, starting from occupation, not to stop too early, unless the job is not the, let's say, most interesting. Volunteering, be involved early enough, not to wait until you go into retirement to do volunteering, because this is one of the lessons we have. The earlier you start, the longer you stay into volunteering. Of course, physical activity, if possible with other people, would be very beneficial, and intergenerational activities. So with the younger generations of any kind, it's usually a very good preventative measure we have seen. So, and at macro level, so at governmental level also, I would say that programs preparing mature adults also on how to address this retirement phase, pre-retirement, I think are very important to prevent people from the big jump into post-work life, which sometimes is a sort of difficult phase, especially for men, we have seen is the case, and therefore probably this would be a specific target group for these kind of programs. I mean, if you think of intergenerational support in both ways, one today probably a crucial strategy would be that of using the new technologies as a bridge to allow younger cohorts to be helpful to the older cohorts, which we know are not so keen or not so used to manage technologies in their everyday life. And we know we have so-called cyber groups of children or youngsters helping older people in using these new technologies, and that's very helpful. So this is very good in one direction. At the same time, it is also a learning experience for many younger people to understand and realize for them that it's not so easy for everybody to use technologies. They have been born with them. They are digitally natives, as we know, and therefore in this interaction they learn a lot also. So it's a two-way learning process. I mean, some of the probably most promising initiatives that could be put in place to support the life of older people who are frail and are in need of care is probably the one which includes from the very beginning in the creation of new services representatives of older people organizations. This is crucial because in this design we have seen in the past that sometimes practitioners do not always consider what it means for the users to be involved in these services. Through the presence of representatives of older people's organizations, this would be probably addressed in the proper way, considering all the different facets of this experience, which for older users is always a problem. When we think of the role of migrant care work in Italy to provide support in everyday life to frail older people, the lesson coming from Italy shows us that we need to consider both sides in a way that ensures dignity in everyday situations, both for those who receive care and those who provide it. And this is very important because sometimes the fact that it has been provided in undeclared form in Italy has led to abusive situations which should be prevented with programs ensuring that this work is recognized, is provided legally, maybe fiscally facilitated, and therefore ensuring that a minimum level of training is granted to the care workers, and on the other hand that monitoring of the quality of care provided to the care recipients takes place by healthcare districts or social care divisions in municipalities, which are the two main authorities in charge of this field of activity. I think that in countries which with a large share of younger cohorts like those in the MENA region should seriously think of putting in place a strategy which makes care a sort of very important pillar of their welfare system. And that implies to make care a job, an employment, a field of activity which can be rewarding, not only economically but also psychologically and socially, and recognized as an important contribution to our society for younger cohorts, so that they are kind of pushed into this field as they feel that they can contribute to the welfare of our society. And in this regard, it is important to have a gender-sensible approach, to make sure that also enough men can provide care in this area, and it's not considered only a women-limited activity. I think this is very important because it would make also the role of care in our society stronger and make the whole society more sensible. I would say that a comprehensive, articulated, active aging policy would be key to ensure that all fields of our aging process, so starting from very young, early age in a longitudinal approach, so thinking that our life's course are in any of these all of the stages of our lives, we need to keep in mind that we have an evolution. Therefore, we need to have a preventative approach towards illnesses in later life, ensure social participation in all areas, ensure that intergenerational solidarity takes place in different fields. So I would say active aging starting early would be a very good approach. One possibility that we have learned across the European member states has been that a longitudinal study like SHARE, for instance, has provided very interesting findings and a data set which can be used for interdisciplinary research to gain a much deeper understanding of what it means to age well, age in a good shape, and what are the different dimensions contributing to that, from social support to economic status, psychological well-being, and so on. And I think that steps are undertaken in this direction to establish something similar in terms of a longitudinal study, starting early in life, so that you can keep track of what the developments of individuals are over time. That would be very helpful to monitor also how things are developing in the MENA region.